Did you hear me?
No, now we can.
Okay. My
Okay, you're good?
no, I gotta go. I will be out for probably 10 minutes.
10 minutes. Okay.
Yep. So go ahead and start. You don't need me.
Sorry, Les. Okay, I'm going to start the work session for February 16th, the Hood River County Board of Commissioners, 4:45. First up is our COVID-19 update. Trish, I assume you're on.
Can you hear me?
Can hear you, but can't see you.
Okay, I'm trying to get my camera on here. Oh, hello. Good afternoon. So I'll just start with some statistics, and I see Dr. Van Tilburg is on as well. I believe Darren is on too. I've seen her name up here. As of this morning, we have had a pandemic total of 1,045 cases. Right now, we have 22 active coronavirus cases in the county. We've had a total of 34 hospitalizations and 29 deaths in Hood River County. So we're continuing with vaccine efforts. We've been doing vaccine clinics every week for the past 5 or 6 weeks. And we've been very productive. We would be more so if we could get more vaccine. We're trying to be patient, but it's hard. We're ready to go. We're ready to be out there and giving lots of vaccines and sharing lots of vaccines with our community partners. And it is frustrating that we're not able to get that vaccine to get it out there. But we have a big clinic scheduled for this Friday, 650 doses at the River of Life Assembly Church, and that'll be second doses. And we are busy setting up and utilizing our new scheduler, which we are hoping will make life much easier for us and have some of that automated processes that will save us a lot of time and effort with the scheduling and making sure that we get recalls in time. So, Darren, if you're on, would you like to talk about the testing events that are coming up next week?
Yeah, absolutely. Thank you, Trish. Hi, everyone. As Trish mentioned, next week we have 3 free testing events partnering with Oregon Health Authority. The 3 events will be Tuesday, Wednesday, and Thursday of next week in the afternoon, evening. I'm happy to pass around the flyers to this group too after this meeting that has the link to register. But Tuesday will be in Cascade Locks at Marine Park Pavilion from 3 to 6. Wednesday will be at Parkdale Elementary, also from 3 to 6. And Thursday will be at River of Life Assembly. Again, we're using their services twice, which is great. And that one will be from 2 to 6, just to accommodate what we think might be more appointments in Hood River. So I'm happy to answer any questions. We will have bilingual services there, and the flyers are also in Spanish. Partnering with some good organizations too, and hope to have a good turnout. So please spread the word. They are free, registration preferred but not required, and I can answer any other questions that come up.
Darren, I have a quick question.
Yeah.
What sort of outreach have you?
So the registration link just went live this morning. Unfortunately, it took quite a while for them to add the site onto the website. So this morning and some of last week, I've been doing email push. Today I went around Hood River and posted some flyers around town. I was thinking to do the same in Parkdale and Cascade Locks. I posted in a couple Facebook groups, and I know Dr. Van Tilburg's health officer Instagram has also promoted it, but I'm very open to any ideas. You know, I'm relatively new to the area. So please let me know if there are groups that you think I should be sending it to. Nextdoor has been really helpful too. They're pushing out the flyers throughout their networks. But yes, I'm very open to any input you have.
Yeah, we have shared it also with the media outlets, radio and paper websites, and we've sent it out through the early childhood and other big networks that we have in the region through the Community Advisory Council and the Columbia Gorge Health Council.
Any other questions for Darren?
Yeah, this is Karen. I have a question around reaching some of our older population. I know we're right now doing 80 and over, but we'll soon be starting to lower the age groups. How are we reaching folks that may have mobility and transportation issues that aren't able to come for an appointment or an opportunity to drive somewhere to get a vaccine? Do we have any kind of reach that is mobile?
I can address that, Commissioner Joplin. So one of the issues that we have right now is the fact that Oregon Health Authority is telling us that we cannot transport vials that have been punctured. So right now we are trying to figure out the best way for us to deliver a vaccine to small groups of people because it comes in vials of 10. I know that Oregon Health Authority is working on that right now. We had thought about somehow partnering with home health or with hospice services to get those out, but they would have the same issues. So Oregon Health Authority has promised to get us more guidance on how to deliver this vaccine in small numbers without having to waste a bunch of vaccine. And just so you're aware, we have been very diligent. We've only had to waste a couple of doses out of over 2,000 doses that we've given since we started getting vaccine. One of those wastages was caused by a faulty needle and syringe set. We do get the needles and syringes from the federal stockpile, and what we get are different with every shipment. So it's quite an assortment, and sometimes they work really well and sometimes they don't. And you just never know what you're getting with those. So we did end up having to waste one dose with a faulty set. And then we did have to waste a dose when it was when we were doing vaccines outside and a big gust of wind came along and blew a vaccine syringe off of a tray, and we wasted that because of contamination. So we've been very diligent. I've been very careful about being judicious about opening new vials towards the end of clinic days, just making sure that we have enough people to give every dose of vaccine to. We do get extra dose of vaccine in many of the vials that we get, and so that will account for the odd numbers that you're seeing in our vaccine delivery. So we're really, really pleased, and our staff have been working really hard. The volunteers have been working really hard to make sure that we're maximizing all the vaccine that we do get.
If I could on that. There was a rumor that came across my desk that Hood River County was wasting vaccine, that vaccines were going unused. And so I contacted Trish. She's clearly debunked that, but I want to make sure that all the commissioners are in the realize that what we just heard is that we're not wasting anything. It's all going into arms, except in these two very unusual situations. So if you hear this rumor, make sure you tell people that is misinformation.
Yes.
They should stop saying it.
That is absolutely not true. We do not waste vaccine. We work extra hard to get people in. We have a standby list at the end of every clinic day that we can get people in within a 15-minute time span to get it so that we don't have to waste vaccine. It's just like gold to us. We're very happy that we're finally feeling like we're doing something positive in this fight against COVID in our community, and we want to maximize every single dose that we have.
I have a question.
Yeah, Trish, this is Mike.
Sorry, Mike.
When we first started the process with the older people, there were three facilities that were providing those, one Community Health, Providence, and Columbia Gorge Family Medicine. In this second week now, third week, are some of the other providers been given any of the vaccines so they can start working with their people?
Unfortunately, we aren't getting as much vaccine as we would like to get, and so we don't have a lot of vaccine to share. We are sharing 250 doses this week, and those are new doses. We are giving 650 doses, which 600 of those are second dose, 50 are new doses on Friday. And so it's very frustrating for us that we're not getting the amount of vaccine that we would like to be getting to really get those vaccines out to our older populations. It looks like going forward, the state has committed to sending Hood River County 300 new doses per week for the next few weeks, which I'm really disappointed with. That's pretty common dosage, a number of doses that they're giving to counties our size, even though we have much more capacity to give a lot more vaccines than what we're getting.
So back to the original question then, some of the personal providers haven't gotten any vaccines at this point then?
That's right. Some of the providers, I believe we have given vaccine this week to one Community Health, and Dr. Van Tilburg, tell me if I'm wrong. One Community Health, Providence, and Columbia Gorge Family Medicine have each gotten some vaccine from us this week. So.
Okay. I know Karen had brought this up a few weeks ago, and we were still wondering about the potential of having a big surge of vaccines potentially in the future. Where are we on that, Trish?
I would imagine that's a few weeks out. What we're looking at is in the next couple of weeks, Janssen's vaccine, the Johnson & Johnson vaccine, is going to be applying for emergency use authorization in the next few weeks, I would imagine. That's a single dose vaccine. Right now, we don't have a timeline for delivery for that. We are still hearing from the state that within, a number of weeks, we should start seeing larger amounts of vaccine coming our way. But besides that, I don't have anything in writing that guarantees that at this point. Dr. Van Tilburg, do you have anything to add?
Sorry, I had to step out there for a minute, so I missed a bit there. But yeah, just to reiterate a couple things. I think Ms. Joplin, you asked about, I wasn't sure if you asked about contacting hard to reach people or communicating or getting them vaccine, but we have a very robust, probably one of the most robust communication systems compared to other counties, as I think I spoke about before. Our phone's ringing off the hook. We have every primary care clinic already with lists of all their patients over 65. So that's the beauty of electronic medical records. So all of the major lists, all of the major clinics have lists of people. And so, as Ms. Elliott said, those few hard to reach people, we already kind of have multiple ideas in the works for that. We're right about at the end of this week, if we get all of our vaccine, we'll be at 6,000, over 6,000 doses of vaccine delivered in our county. And I think the question about who is giving vaccine, Providence, Columbia Gorge Family Medicine, One Community Health, Summit, and Safeway are all giving vaccines this week. And we probably have 2 more clinics coming online next week, but largely we're just waiting for vaccine. We have the capability of giving 2,200 doses per week in our current system. So we're just waiting for vaccine.
Yeah. So we did hear just late this afternoon that Safeway was scheduling vaccine for people who were eligible. Darren, were you able to get any specific information?
Yeah, I spoke briefly on the phone with the pharmacy manager who said they only got 100 doses this week and they're all spoken for, and they don't know what the guarantee is for what they'll get moving forward. So it sounds like I don't know how much notice they were given, but it sounds like it was a pretty quick turnaround.
Yeah.
Are the pharmacies working on specifically just people calling that meet the criteria, or are they responding to primary care physicians? How does that work?
It looks like they are screening people on their website for eligibility, and so it is self-referral. I would imagine that their word of mouth, travels quickly, and that's how we found out. As somebody called us and said, "Oh, did you know? By the way, I was able to schedule a COVID vaccine at Safeway today," and so yeah, that's great news. I hope it continues to come into our area, into our region, and becomes easier for people to access.
So if I could ask, right now, as an example, we are eligible for vaccination, and I believe census number said there's something about 1,000 folks in that category living in our county currently. Some of them have primary care physicians, some of them have a relationship with the pharmacy, some of them don't have any of that. If you're in that category, what are you doing today? How are you getting in line? How are you getting the vaccine?
Well, and actually, as of people this week, it's age 75 and up are eligible starting this week. So people need to call their primary care doctor. If they don't have a primary care doctor, their pharmacy, they can talk to their neighborhood pharmacist. They can call community clinics. Most of our providers are offering some opportunity for people outside of their patient empanelment to schedule appointments. I know One Community Health does. We do when we have vaccine available. So we'll just keep plugging along.
So I understand that this week, 75 and over are eligible, and is it next week that it becomes 70 and over? Is it 5 years a week? But we're not able to vaccinate anything near that rate. So I guess my fear here is that we have plenty of people who are still 80 and above who have not yet been vaccinated, and they may just be lost in the rush. They're less capable of advocating for themselves in some ways. So we're doing
that's why we've been really working with the providers to make sure that they have their patient lists ready. We're also, happy to take calls from caregivers, and we do get lots of calls from family who are providing care for people who are in those age groups, and getting them scheduled however and wherever we can.
So are the 80 and above being prioritized over the 75 to 80, or is it?
Well, that I'm not completely clear on. So I would imagine, anybody over this age of 75 right now is eligible. We will certainly ensure that we are advocating for those people who have less ability to get in or to make an appointment on the computer. We have our phone lines are now open and taking calls for people to call who don't have internet access and need help scheduling either with us or with other people.
Can I make a brief comment on that? Is that I would just echo what Trish said, what Ms. Elliott said, in that all of the primary care clinics are going to try to prioritize 80 plus first. It's not going to be perfect. So if they have, Providence is going to get 230 doses in this Friday. If they do, 200 in 80 plus and 30 and 75 plus, that's just the way it's going to be. But we're going to try to follow the sequencing plan as much as possible. And as soon as our phone line, our call center is up, we're gonna, I think we will collect a list of those people over 65 who don't have a PCP. And so we'll get the list. Everybody's going to get vaccinated. We probably, as Ms. Elliott said, do some of those in the health department. Some of them will probably offset to one community health. Everybody's going to get vaccinated. Everybody who wants a vaccine is going to get vaccinated. So it's just, we're largely waiting on vaccine.
Mm-hmm.
So I guess the reason I think of the model of airplane boarding, where they say, they start announcing group 1 should board now, group 2, group 3, group 4. They're announcing group 3, group 4 before group 1 and 2 have even gotten on the plane, but they're at least in a queue so that they're ordered, so that the line is theoretically largely in order. And I'm not sure that we have that queue in place so that the folks are being vaccinated in the appropriate order. I'm not sure. I mean, I think you might have addressed that, but I'm not sure I followed that.
So the primary care providers definitely have their empanelment prioritized, and it's easy for them to do that because they know who their clients are. We don't necessarily know who they are, and so when someone calls us and says, I'm 79 years old, I want to get a flu vaccine, or I want to get a COVID vaccine, can I have an appointment? And we have an opening appointment, we're going to schedule them. So that's, we don't know these people like their primary care do. But one thing we can do is encourage them to go through their primary care provider. And that's why we are committed to providing vaccine to those primary care providers that do take care of those patients.
Do we have any our elderly population that have PCPs? Is it more than 50%? Is it very high, or?
I don't have that. I can get that.
It's probably around 85 to 90%.
I'm not looking for an accurate number, just a guess. That's excellent. Thanks.
We know
that's encouraging.
We know exactly how many people over 80, over 75, and over 65 are in Providence Internal Medicine, Providence Family Medicine, Summit, One Community Health, and Columbia Gorge Family Medicine. So all of those tiers, those airplane boarding groups, as you explained, those are already lined up for the majority of the main clinics. the 3 or 4 smaller clinics that I've been in contact with already have that information too. So everybody's lined up, ready to go. We're just waiting.
Great. So it's not perfect, but it's roughly the way I'm imagining it. Thank you.
It's pretty near about as perfect as we can get it. I mean, it's a really fine system that I think Ms. Elliott has built, and we're ready to go, and we have everybody lined up, and we're just waiting.
I just mean there's some people who are going through pharmacies, some people who are going through the health department. In that case, you don't have them in your record system. So you're taking them at their word for what their age is, and you're not necessarily stacking them the same way that the PCPs are.
Well, and we really haven't gotten too deeply into that population either. I mean, most of the folks that we've vaccinated outside of first responders, healthcare providers, and teachers are those people that are receiving in-home care and or are caregivers. And so those are the populations that we've been providing most of our services for. I would imagine that, like Dr. Van Tilburg said, that the majority of our seniors do have primary care. What I'm concerned about is people whose primary care may be inaccessible. Maybe they see primary care in Portland or in Vancouver, and it's not as easy for them to get there.
Yeah, I guess just to piggyback on the conversation, because I've just been through this with my grandmother who's 91, and the issue that she had is she contacted her primary care physician and they didn't have any more of the vaccine schedule. And so what they said is, well, you can wait until we get more vaccine, but that was going to happen after the next change in the age range situation. And I think that that's still not an issue, but I think this really could be an issue that will compound as we move forward into the larger chunks of ages. And so what they recommended she do is do everything she could to find a vaccine before it moved into the next position, which is kind of what Arthur was speaking to a little bit. And I appreciate that Dr. Van Tilburg said that they're going to try to prioritize those folks in the next round, but it seems like we're right on the edge of something that could be a little bit. I know it's not you guys' fault, it's the schedule that's been put together by the state, but it's just a little bit, it is concerning, and I think it's something that we do everything we can to avoid it being having those folks get squeezed out. And
I fully agree. I fully agree. I was really hoping that, I mean, we did request 3,000 doses to receive 3,000 doses in 3 weeks. And I was basically told that wasn't going to happen. So.
This is another experience similar to Bob's experience is my mother, who was 86, a patient of Providence. She received a notification through her MyChart last Tuesday and was notified with a direct link to schedule a shot for that Friday, which inadvertently was canceled due to snow and delayed to this coming Friday. But it was a very easy, simple process. The link was straight direct. You pick a time, they're in 10-minute increments, very quick and easy. She was notified ahead of time by 5 days. I was really impressed. I thought it was great.
This is Les. I think the issue you're going to run into is the folks who are not savvy on internet, and I would put my parents in that category because my dad's 79 and is trying to figure out how he gets scheduled. So he's making phone calls because he doesn't use a computer. And so there is that older generation, that demographic, there is a disconnect in terms of using electronics, and people don't answer the phone, which I understand because you guys are busy, the pharmacy at Safeway is busy. And so I think that's another part of it, unless there's a family member sitting there shepherding them through the process, which I don't go into my parents' house, so I'm struggling a bit to help them. It gets to be an issue.
Yeah, it definitely does.
So,
it's very frustrating.
Mr. Perkins, so we have a phone line that's answered. We have a phone line in an informational line in Spanish and an informational line in English. And then we have a scheduling line, and we have already helped hundreds of people schedule their appointments. So that's a great problem that you brought up. We've already addressed that. And so.
Okay, that's probably my fault. I'd understood that they weren't supposed to call the health department.
They're not supposed to call the main number, but if people are eligible for a vaccine, we can help them schedule. But
Okay,
that's if
perfect.
we're not, the health department's not vaccinating 80 plus patients. Those are all being done by the primary care clinics.
Got it.
So keep in mind, we only have 200 vaccines in our county right now
Yeah.
for 80 plus. That's all we got.
Yeah. No, that's helpful to know that they can call that, not directly to the health department, but a separate line.
Mm-hmm.
Okay.
I think the experience that we've seen from the parents and grandparents of commissioners should, let us know that, number one, that you folks are doing a great job, but number two, there's an awful lot of communication that's still needed. And I understand it's just starting to open up to different age ranges. And I know we're going to hear a different story next week, but it sounds like all of us have a lot of work to do between now and then.
Mm-hmm.
I think
Trish, I have one question on the numbers. You say maybe next week we'll get 300. So is a place like Safeway, is that it? That 300 part of what they're getting, or did they get it separate from you?
No, theirs was allocated completely separate from us. My understanding is also that One Community Health will be receiving 200 doses per week. That's not just for Hood River, but that's for Hood River, Wasco and Sherman counties. So they'll be sharing those 200 doses. And I believe that's starting the week of the 22nd. They're going to be receiving that for the short term anyway, weekly. And so we are going to be getting at least 300 doses of new vaccine, of dose 1 vaccine every week, starting the week of the 22nd. And so we know that we can count on at least being able to parse out that much to the primary care providers, which is not much. But One Community Health was also going to be getting some. It would be great if Safeway were to continue to get vaccine too, so that, it would be great to be able to get as many people in these age groups vaccinated as soon as possible.
Well, Trish, I said earlier, if you ever needed me to do something to talk to certain people, let me know. I don't know if it helps, but I know a lot of counties are doing that, where they're getting their person that talks to the governor and starting to talk about things when things don't look like we're getting our fair share. If you think that's the case, let me know, please.
Well, of course I think that, and it can't hurt, right? So I think that we're ready. We're ready to provide this on a wide scale basis. Lots of vaccines per week, lots of vaccines per month, and all we need is the vaccine to do that with.
Okay, thank you.
I think this clinic you're doing, 650 folks at the church this week. Please, that sounds like a great, basically dry run for what we're going to be doing on a regular basis in coming months. So please let us know how that works, and I'm really excited to see that volume happening. And if we can do that, then you're right. We're just waiting for the vaccine to come in.
All right. If you're interested in volunteering for that clinic, let Belinda Balla know. And you don't have to be there for the whole time. It's going to be a long day, I will tell you that. But we went and did we did a walkthrough of the facility today, which we've used it in the past for flu vaccine clinics, but we're very excited to we like to test ourselves and push ourselves and see how many we can do and how smoothly we can do it. And it's been going really well. And I have to say 240 doses is pretty ho-hum now. So now we're going to try 650. We'll see how that goes.
Wow. Okay. Any other questions for Trish or Darren or Chris?
Chair, this is Karen. I have more questions for Darren, but they're unrelated to the health department and vaccines. Would you like me to ask that now, or maybe?
Sure, we got a couple minutes.
Okay. So Darren, hopefully part of your job description was to do some liaison work with our legislators and to kind of keep us informed of any potential additional business resources for economic pitfalls from the COVID pandemic. And I was wondering if you'd had any opportunity or if you'd embarked on some of that work with either the Nate Stice perhaps, or our local legislative representatives, any conversations around any additional relief that may be coming, or anything around kind of our business community and the economics of this pandemic?
Yeah, that's a great question. Nate Stice has been a great resource for me, and he got me connected with Jessica Mata, who I may mess this up, but it's the Mid-Columbia Economic Resilience Group. So I've been able to be a part of the last meeting that they had, and I think that'll be a great opportunity for me to share anything that comes up down the pipeline with local businesses. But I also know that there was a relief package possibly coming to the city, but beyond that, I'm doing a little bit of research, but I really haven't been connected with any legislative. If there's anyone you'd like to connect me with, I'd be happy to speak with them and see how we overlap.
Well, I would recommend Anna Williams and Chuck, just to introduce yourself and what you're looking for, and if they have any ideas to keep you in line or informed so that they can know who to pass information on to once they receive anything.
Great, thank you.
Darren, this is Mike. I'll forward you their email addresses so you can get them.
Oh, perfect, thank you.
Okay. Any other questions?
Darren, just one for different ways to get news out in the community, like concerning the testing thing. There is it's funny to say, but there's a chat room on called Hood River Weather, where people sit around and talk about all sorts of things. I just checked to see if they had any mention of your clinic, and they do not yet. So let them know. And in fact, I can introduce you to the guy who keeps the chat room. He can put up a sticky note on the chat saying that you have this clinic running. It's a percent of the population. It's not everybody, but especially when we have a snowstorm, pretty much everyone at some point will go there, and you can get in touch.
It's a surprisingly effective medium, actually.
I was going to say that's something I wouldn't have thought of. So great.
No, the Hood River Weather chat is one of those places that gets information out pretty quickly. So,
what platform is it on? Is it just a?
It's a home build site. It's hoodriverweather.info.
Hoodriverweather.info. Great.
Yeah.
Thank you.
Any other questions? Okay, thank you, and appreciate all your hard work. Keep it going, and we'll talk to you in a couple of weeks or so. And Trish, again, if you need me to do something, let me know.
Please do. Thank you.